Okay, well, everybody, my name is Mike. I am a physical therapist working at St. Mark's Outpatient Therapy Clinic. Little bit about me is, well, I'm a Utah born and bred, and um, graduated from the University of Utah in physical therapy after trying many different things, but absolutely passionate about what I do. Absolutely love working with people achieve their goals, get out of pain, get back to really what they enjoy doing. If I'm not at the clinic, what you'll find me doing is I'm either gardening, hiking, or backpacking somewhere in Utah. So, today's presentation, we're going to be talking about back health. All right. So, when we first discussed doing this presentation, there was a lot of different routes that we could go. Um, we've broken down the purposes of today's meeting into three main parts. So first, understanding some causes of back pain. Second is strategies to help prevent back pain and strategies to help manage back pain if you're currently having it. Now, back pain is as versatile as there are people on this planet. There is absolutely no cure all for all back pain. So trying to address like, well, if you have back pain, this is the one exercise you need to do. That's just not how it works. So trying to take all of this information that we have out there and synthesize it into the time we have here together is almost impossible. But if you guys have any questions, put them in the comment box and we will address those as best we can. So the first thing that I want to talk about is understanding back pain. Low back pain is the most commonly hit spot in the spine when people talk about their back pain. 50 to 80% of adults will experience back pain at some point in their life, and it's ranked as the highest cause of disability, even more than any other condition throughout the world. We spend millions of dollars on it every single year, billions annually in the US, and $21.8 million of that um, goes directly to the ergonomic setup of people's offices, meaning what kind of chair do you sit in? Where's your computer set up? Now, everyone here is kind of listening on a computer, so we're going to talk about how, ideal setups, kind of the different ways that you can have a healthy spine in an office setting, although that's not the only way that you can get back pain. So here's a graphic just kind of illustrating that point again. 3.5 million people are affected by back pain by degenerative discs. 50 billion spent each year. There's a long list of different things that can cause back pain. But it's important to know that no matter what kind of back pain you're having, that you're not alone, that it's a common thing to have, and that it's not a end sentence on you. There's always somewhere that you can improve. There's always something that you can help to improve your own quality of life. Okay. Now we're going to talk a little bit about the anatomy of your back. So the back is absolutely amazing. In fact, the human body is amazing. There's no mechanism on earth, there's no machine, computer, anything that is as adaptable as the human body. Okay, so if you're looking here, you have 33 bones running down your spine, and it encapsulates that long yellow string. That's your spinal cord, and you can see those strings kind of coming out on either side. Those are your nerves. Those vertebrae protect those nerves because the nerves is how we feel anything. That's how we feel temperature, touch. We feel basically all sensations through our nerve pathways, but that also includes pain. So really, our bony spine has one purpose, and that's to support us and to protect our nervous system. So in between each one of these bony vertebrae, we have a disc. Okay, this is a disc. It's kind of spongy. It's more of cartilaginous tissue. It's really there to cushion the spine. It helps rotate the spine. And that's how the spine gets its nutrients. You can see this nice circle right there, the intervertebral foramen. Now that's where the spine has a nerve coming out, and that nerve will go to a muscle, it'll go to an organ, it'll go to different things to kind of provide sensation and give us the power and energy to like move around. Now, over that, over your bony and cartilaginous tissue, you have muscles going down. Now, this is a picture, it's from Gray's Anatomy, so older kind of diagram, but it just kind of illustrates the number of muscles you have going down. You have 40 muscles just on your back, so that's over 20 pairs of muscles supporting you that have to work as a team. Now, that's just on the spine, and that's not the only part of your back that we have to talk about when we're talking about back health. You have muscles throughout your core going up across your fronts. You have hips and you have your lower legs that all influence the overall stability of that spine. And so you think of the complexity of these muscles having to support this back. If anyone here has ever had to work on a group project with 10 or more people, you can understand the frustration that happens there. How amazing is it that every single day you have hundreds of these, perfect little mechanisms working in, more or less cooperation to keep you out of pain and get you to do the things that you need to do each day. Now we're going to discuss the types of low back pain. And the types of low back pain, you can have back pain from so many different areas, from discs, you can have them from bones, you can have them from muscles, you can have them from nerves. So to simplify things, I broke it down into 3 types of low back pain. First, acute. Acute pain comes on suddenly. It typically lasts less than 3 months. That can develop into chronic back pain, which is back pain that typically lasts longer than 3 months. Or you can have recurrent back pain, meaning that you have acute back pain, it might last for a few weeks and it'll go away, and then you'll have another episode of acute back pain, which limits you on how you move, what you do, might limit you at work or at home with your family, recreational activities, anything like that. So looking at those 3 different buckets that we can kind of put ourselves into, we're all going to, well, the majority of us, at least 80% of us, will experience acute pain in our back at some point in life. Now, it's important to know that acute back pain usually does self-resolve. It usually takes care of itself, and we'll discuss kind of how to best take care of that. Chronic pain, if you have pain for a certain amount of time, your nerves will physically change and your body will adapt in different ways. And it's at that point where it's like, hey, the regular stuff is not helping. That's why you have a team of doctors, therapists, health experts. There's tons of people who can help you break that chronic pain cycle and get back to living life the way you want. So the most common causes of back pain are overuse, injury, and strain. Very basic, that can mean a lot of things. Overuse might be repetitive motions. A lot of people work and turning from side to side hundreds of times each day working on assembly lines. A lot of people are sitting in a certain position for multiple hours at a day. Now those are also overuse injuries because those muscles have to be constantly turned on for hours and hours. Injury and strains, those could be anything from lifting things, from turning quickly to falling down, anything basic like that. Now, there are other causes for back pain, but these are less likely causes. Degenerative disc disease, lumbar spinal stenosis, osteoporosis, bulging discs, herniated discs, pinched nerves. The list can go on and on and on. I really didn't want to put them all on this slide. And of course, I know there's somebody listening here thinking to themselves, well, Mike, you don't understand. My back pain is unlike anyone else's. I have a vertebrae that is flipped upside down, inside out, and has fallen right out of me. And that may or may not be true. I just want you to understand that the majority of back pain that we will all experience at some point in our lives is rarely tied to one of these more serious causes. Now, here are some red flags to be aware of. If you do have back pain, this is the time that you need to seek medical service ASAP. If you have incontinence or difficulty urinating, meaning that you have change in bowel or bladder, you have poor balance, a sudden onset of poor balance, or you have numbness or weakness in the legs. And a lot of times that'll be in a and a saddle paresthesia. So kind of like right in between the legs, kind of like where a bike seat would hit you. If any of those suddenly come on or come on gradually over a few weeks, that's a time to go to the doctor because a nerve is being compressed or having a little more pressure than is healthy for that. And so we want to relieve that as much as we can. Now, but remember, the majority of us will not have any of these things happen. 85% of us will experience, well, of the 80% of us in the world who will experience back pain, 85% of those people will be experiencing non-specific or mechanical back pain, meaning that it is not tied to stenosis, trauma, cancer, infection, cauda equina, or anything scary like that. Okay? It's back pain that can be easily treated. Your body is adaptable. It can adapt to new environments and changes that we place upon it. So I'm going to talk about imaging because, again, I know there's probably someone in our audience who is thinking, well, I have an MRI showing I have bulged disc and degenerative spine, and so told me that this was the worst spine that they've ever seen. Okay, and that may or may not be true. You might have a bulged disc, you might have degenerative disc disease, and I will not argue that. But I want to point out something to you. There are shortcomings in imaging, and science is starting to speak more to this. So here we have a graph. Red is people who have back pain. Blue is for people who don't. On the left, you can kind of see the percentage of people who are experiencing that. So the first column is degenerative disc disease. They took people, about half of the people who had degenerative disc disease had back pain. About half of the people who had degenerative disc disease did not have back pain. Spondylosis, same thing, about half and half. Scoliosis, about half had back pain, half did not. So all these people had some kind of thing going on in their back that you could see on an X-ray or an MRI, but they did not all experience back pain. So that raises the question, what is causing the back pain? It's obviously not degenerative disc disease, or else everyone would have back pain who had degenerative disc disease. This next slide, lots of numbers here, I know, but stick with me because imaging finding, up here is the age. So you have 20, 30, 40, 50-year-olds, 60-year-olds, degenerative disc disease. Now, this is taking people who are asymptomatic. So all these people, 100% of these people had no pain. So you take 120-year-olds, they put them through an MRI. About 30% of those, or 37% of those 20-year-olds had the disc degeneration. So they're losing height in those discs. That compressive cushioning is kind of shrinking over time. That's a normal process. You can kind of follow that down. And we all kind of have changes in our spine over time. And now this can cause pain. I'm not saying that it does not cause pain, absolutely not. But I'm saying for the majority of us, we will have disc degeneration. We will have some kind of height loss. We might have a disc bulge. But that does not always result in pain. I want you to keep that in mind as we kind of continue through that. I'm going back for a sec. Looking at all of this, synthesizing this, I tend to think of disc degeneration, disc bulges, everything like that. Yes, it's a natural part of our aging process. We all get laugh lines, but not all of us are really worried about the wrinkles on our face. Disc degeneration, you can kind of think of laugh lines in your spine. There are times when it becomes a little more serious and can cause pain, and luckily we have wonderful surgeons, therapists, and healthcare teams who can help you address that. But if you have back pain, stay calm, and remember that it's probably not anything that requires immediate surgery. Okay. So now we're going to be talking about preventing back pain, which prevention is always better than a cure. There are so many different ways to experience back pain in life. Some people can experience back pain going down the legs. Some people experience pain just right across the top of the pelvis. Some experience back pain going from the neck all the way down to the tailbone. And so trying to address all of those different ways to experience back pain in one presentation isn't super likely. But talking about some ways to avoid all kinds of back pain, we can do that. So at the office, which, you know, we're all at computers, so I'm assuming everyone is at the office at some point who's participating in this. There are some things that put us at risk for back pain, which we're going to discuss in the next few slides. Since COVID started, I've seen a lot of strange office setups. I've seen people working in bed. I've seen people working at kitchen chairs. I've seen people working in lazy boys. I've seen people working in a nice office, and not everybody has that. So with that change, I don't know if anyone's working from home today, but I want you to take a look around and take a look at what you might be able to change in your own environment to avoid any back pain. So, setting yourself up for success. Looking over here on the right, there's a nice picture of this perfect, posture person. Now, understandably, not everyone can have this, almost robotic setup, but we're going to discuss a few principles for you to minimize your risk for back pain. Proper office ergonomics can help maximize your comfort and safety. So the following are just some guidelines to help you set yourself up for the best success. The first is a chair. If any of you are using a kitchen chair, and I'm talking about one of those hard, straight back wooden chairs, and you're working in that for 5 to 8 hours a day, please invest in yourself and get yourself a better chair. You want your chair to be mobile. Usually 5 wheels is better on the bottom of your chair, kind of helps you to shift around. It just moves easier. The ability to twist freely on its base prevents you from having to over-rotate in your spine, which can strain muscles after they've been in a static position for a while. You want it to be adjustable height, and you want the armrests that allow you to sit close to your desk. You don't want your armrest so you're way back here trying to reach forward, bending through your spine while you're having to type or do your work. The next part is you want lumbar support. Lumbar support means the low back. You want something that kind of gives you support in that natural curve. You don't want to be slumped. You don't pull back to be shaped like a C. If your head's up here and your butt's down here, this is a totally curved spine. That's not great for your back. It puts undue pressure on those discs and undue pressure on your muscles. They get tired and puts them at a higher risk of strain and injury. You want the base of your seat to be an adjustable angle, meaning that you don't want that chair to be slumped way back so your butt slides back into the back of the chair, or you don't want it to be sliding forward so you're sliding out like a slide. Okay, so looking at these two pictures, choose the chair on the right. Don't choose that weird, cushy office. I don't even know where that chair came from, but I thought it was hilarious that even someone tried to develop a chair like that. That's a recipe for back pain. The next, which none of us really think about a lot of the time, is our keyboard positioning. We work off laptops a lot of the time, so screen and keyboard are very close to each other. But you want the keyboard that allows you to adjust the height. You want your forearms to be slightly beneath the horizontal line. So the picture shows there a 90-degree angle where her arms are bent. Having a greater angle than that, a greater angle meaning about 110, slightly lower than that, decreases the risk of back pain in the upper back and the lower back. See, as you raise your arms up, naturally you start to extend. The muscles up here start to become tight. A lot of people complain like, oh my gosh, I get so stressed out at work and I hold all my stress right here, my upper back. I get so sore and tight. And I'm like, well, your job is probably stressful, but also your posture is terrible. So we can change at least one of those in a day. You want to be able to slide your knees under the keyboard or the tray of your desk. And you want to avoid reaching for the keyboard by extending your arms or having to hunch up those shoulders like this and trying to hold that for hours on end. As much as you can, try avoid having the keyboard on top of your desk. That's almost too high for everybody. That causes you to have your elbows bent beyond 90. But if you can't do that, try raising your seats. And if you have to raise your seat up and all of a sudden your knees or your feet can't touch the floor, you can always stack something under there so you can find good support. Next is monitor your monitor. The monitor should be directly in front of you, and the top of the monitor should be at least at your eye level. And it should be at a distance where you can clearly see without squinting, leaning forward, or moving backwards. A lot of people have glasses, and so if you need glasses for reading, you might talk to your eye doctor about getting a special pair for the computer for a set distance. You can see Granny over here. She has bifocals, and so she has to lean forward, tilt her glasses up, raise her shoulders. And if you're doing that constantly throughout the day, your muscles are going to be overused, tight, and sore. The next thing, if you're working in an office, is move regularly. Physical therapists, we love to say motion is lotion for the body. If you're staying still and you're not moving, things tends to clamp up and tighten down, and you want to avoid that by regular movement. So I would suggest taking 30 seconds at least once every hour, moving your head side to side, rotating it back and forth, looking up and down, rolling the shoulders back, stretching out the forearms, because with all the typing, these guys can get really tight. So stretching out the forearms like this, stretching out the back by pressing hands together, and then squeezing the shoulder blades together by bringing your arms back, turn around here, and squeezing those shoulder blades back and down. So doing those things can kind of release some tension that builds up throughout the day. As office workers, I understand we definitely get sucked into our work. And it's easy to look at the time and realize, like, I have not moved in 3 hours, and I can tell. So if you struggle with that, if you're one of those go-get-em workers and you tend to work for hours and hours without moving, set a timer for yourself. Once every hour, take 30 seconds. Your health is worth taking 30 seconds every hour for. The next talking about is lumbar spine. It's just coming back to this. Now, this is the most commonly affected area. It's at work whenever you bend, lift, stoop, even sitting, that spine is at work. It's kind of the center of gravity sitting right on top of our pelvis. And so to protect that area, if you're in a job where you have to lift, lifting mechanics are key. So a few good just reminders about how to lift to keep your back nice and healthy. Okay, I want you to position your body directly in front of the object and carry that object close to your body. If you're trying to carry it way out here, it's not going to work. Body mechanics and physics, they're bent against you. Bending your knees so your legs and not your back bear the weight is absolutely crucial. Keeping that back straight. And do not twist the back when you're carrying things. Now, the spine loves rotation. Lying down and twisting your spine side to side, or sitting up in an office chair, twisting side to side, is actually very healthy for your spine. It increases fluid exchange between your discs and actually helps to calm down spinal nerves. The back does not love rotation when you're carrying heavy things. So think about snow shoveling. You scoop a shovel of snow, 30, 40, 50 pounds, depending how big your shovel is, and then twisting to throw that over your back. I'm sure all of us have had a relative or two, a neighbor or two, who my back went out while I was shoveling snow. If you have to turn while carrying an object, keep that object in front of you, keep your toes pointed in the direction, and take a few steps. It might add a second more, but it will save you weeks of back pain. So now we're leaving the office, talked about our lifting mechanics, and I want to talk about regular physical fitness. There are several key factors in maintaining a healthy spine, and the overwhelming evidence talks about regular physical fitness. Now, that looks very different to a lot of different people. But some of the key factors of having a fitness regimen, whatever that looks like for you personally, it maintains muscle strength and flexibility. We don't usually get injured when we have strong, flexible muscles. We usually get injured when we have tight, weak muscles. So, overwhelmingly, we find that a regular fitness routine prevents overuse strains and nerve hypersensitivity. It's not always a broken bone or a strained muscle that causes pain. Our nervous system is like an alarm system. It's meant to keep us safe. Now, if we have many instances where we put our bodies in harm's way, or we have chronic pain that creeps up on us, our nervous system will increase the sensitivity. And so now your pain threshold has decreased a lot. It doesn't necessarily mean that you're injuring tissue, but it means that you feel pain much more readily. Regular physical fitness actually makes those nerves settle down, turns down that whole alarm system, and so you're able to do more and be more active with less pain. So systematic reviews and meta-analysis, just lots of fancy statistic words. It links exercise to a 35% reduction in the risk for low back pain. And if we're talking about sick leave or PTO, exercise was found to reduce sick leave time for low back pain by 78%. So if you're thinking about, I saved up a lot of PTO because of COVID, didn't go anywhere last year, you really don't want to use your vacation time to be at home with a backache. You really want to use that vacation time to do something fun. So get out, move around, exercise, go on vacation. As a physical therapist, people always ask me, what's the best exercise, Mike, that I can do for my back? What's the absolute best exercise? What's the one thing that I should do more than anything else? And the answer that I give is choose the exercise that you're actually going to do. I could pull out hundreds of exercises, thousands if I really sat down and thought about it. But really, it doesn't really matter unless you're actually doing them. So when people are talking about, well, I don't really have a regular fitness routine, think about what you enjoy doing. If you enjoy being out in the sun, maybe walking or maybe trying running might be a great fitness routine for you. If you have goals or if you've always wanted to participate in a sport, there's wonderful classes out there for boxing and swimming and pickleball and tennis and whatever you might be interested in. Picking out something that you're interested in makes it fun, makes you engaged, and makes you consistent. Now, if you have back pain currently, of course, the answer is very different. It depends on where that back pain is originating. What's the cause of the back pain? What weak muscles contributed to the cause of that back pain or initial injury? And for that, you really need a skilled physical therapist to break down your functional movement. We are experts in human movement. So we can watch you move and very easily pick out compensations that you might have developed over years from pain or from avoiding pain, different things. So you can get with a physical therapist and they can design a very specific program to get you out of pain and into an activity that you like to do. When I have patients come to me, I'm always asking, what is the one thing that you would do if you didn't have back pain? And when people tell me, well, I would just go home and watch Netflix, I'm like, that's not a good answer because you can do that with back pain. I'm talking about something a little more active, a little more fun that you can't physically do. So think about that, things to consider. Now, from the American Heart Association, this is a recommendation. This is a good goal for all of us to have, is to get at least 150 minutes per week of moderate intensity aerobic activity, or 75 minutes of vigorous aerobic activity, or a combination of both, kind of spread throughout the week. You don't want to just run for 2 straight hours and then be sore the rest of the week. They also recommend that you do high intensity muscle strengthening, which they say moderate intensity. They say high intensity muscle strengthening. That's different for every single person's body. That's kind of based on your heart health and your muscle strength. So again, if you have any questions, contact your doctor or physical therapist and they'll be able to help you initiate something like that. But here's a good rule of thumb. If you're walking and you're easily to carry on a conversation and you have no shortness of breath and you don't feel like your heart rate has risen at all, that's not nearly moderate enough. You need to pick up the pace a little bit. Aim for about 15 to 20 minutes each day and you'll find a drastic change in not only your pain, but also your mood, your cognitive focus, and we could go on and on about the other things that research has shown us. So again, going back to the office, spend less time sitting. Even light intensity activity, meaning getting out and walking, even if you're not out of breath and your heart rate doesn't rise, it does show to prevent some of the risks of being sedentary completely. Now, if you really want to be active and getting more than 5 hours per week of exercise, they found even greater benefits of that. So, more the better. Now, recommending exercise is always a double-edged sword. I've had plenty of people like, well, get moving and it will help with your back pain. Start exercising, start strengthening the core, and it will be great. And then I have people come in and like, well, you're not a very good therapist. I went out and I exercised and I am in excruciating pain. I ask them, well, what did you do? I did 500 sit-ups. Like, well, that makes sense. That wasn't the best move. You need to increase the amount and intensity gradually over time. And don't beat yourself up about it. If walking for 10 minutes is all you can do before that back pain starts to increase, tone it down. Slow down your pace. Focus on your breathing. And then try and go a minute longer the next day. Our bodies are adaptable. They are incredibly adaptable, but they need time to adapt. So if you're currently in back pain, we're going to talk about managing some of this back pain. Now, like I've already said, we have too many ways that we can experience back pain to address everything in a presentation like this. So these are the general principles for managing your low back pain and curing your own back pain. Movement. It used to be, oh, doc, I have back pain. Okay, go lay down for a couple of days, take a couple aspirin, and call me in the morning. That is no longer what we do. Do not go lay down. Do not stay sedentary. Don't stay in your chair all day. That will increase your nerve sensitivity. It will increase your pain, and in the long term, do you no good. You want to remain active. And by remaining active, I mean performing your daily routine as much as possible without overdoing it. So if your usual routine is working for UPS and throwing boxes around that weigh more than you, that might not be the best usual routine. Usual routine, getting up, getting dressed, going about your day, moving, and staying out of a chair or bed. The next is seek education. Understanding pain and getting tips to self-manage pain can be beneficial for any kind of acute and or chronic pain. So when you have back pain, try and contact somebody who understands the pain and is familiar. Again, a physical therapist, a doctor. There's plenty of people out there. Going on WebMD is a great way to kind of scare yourself if you don't know what you're looking for, because the symptoms of a muscle strain can be very similar to, oh my gosh, I have a tumor in my spine. It's not the same thing. Remember, most likely it's just a small thing that will resolve in a few weeks. So the other thing I want to recommend, those things are always recommended for back pain. Stay moving and seek education from a reliable source. But these are things that are sometimes appropriate depending on the back pain, things that you can try that are relatively safe. So ice and heat, either one is effective for back pain. People always ask me, well, which one is better? And both decrease back pain by increasing blood flow to the area, increasing blood flow to those nerves to decrease their sensitivity. I really ask people what they prefer. Some people think, well, I've been icing it, but I can't stand being cold and my whole body shakes. Like, well, maybe you should go with a hot water bottle instead. Rule of thumb there, you want to ice or heat for about 10 to 20 minutes and then give yourself a 10 to 15 minute break. You can even alternate between the two to help modulate some of that pain while it's really acute and inflamed. The other thing, there's a slew of over-the-counter medications. Side note here, as recommended by an MD, many people are on medications prescribed by a doctor that do not react well with over-the-counter medications. So be sure that you're being safe and being smart about them. There's also very specific stretches and strengthening exercises that you can find. There's a lot online, but I would be wary of that. Depending on the cause of your back pain, some things might actually increase that back pain and prolong your healing. So again, contacting your doc and physical therapist, those are going to be your best bet to get you out of pain the fastest. Now, these things are also helpful for back pain combined with active treatments. Massage is wonderful, acupuncture and spinal manipulation. Spinal manipulation being something that you might experience in a physical therapist or a chiropractic office. Yoga is also a wonderful tool to use to kind of help loosen muscles and to reintegrate that muscle contraction, bring that whole team back together to work well. Now, all of these are great, but none of them are a cure to back pain. All of them can help modulate pain. But if your back pain persists, that's when you need a specialist to kind of guide you in an appropriate direction. So contact your physical therapist and find out what is going to be the best for you. Again, the only thing that I would say not appropriate across the board for back pain is bed rest. Prolonged bed rest is associated with worsening symptoms, increased pain sensitivity, and increased risk for future injury. So stay out of bed, get up and move. I know it's very tempting to stay in bed when you have back pain, but stay moving, and I promise the long run is much better. So I don't want to leave you with anything, so I've compiled a few stretches, a few different things that you can start to do if you are currently experiencing back pain. These are relatively safe for a number of injuries, but if you attempt any of these at home and they cause any sort of pain, stop. No pain, no gain is not a thing. So, supine glute stretch, rotating that body. You can see that first one, she's pulling that leg across, rotating those hips, finding a good stretch in her glute or her belt muscle. The next, supine core strengthening, putting your hands on either side and tightening that deep muscle. When we talk about core, I think a lot of people think about the six-pack, and the six-pack is sexy, but it is not your whole core. It is one muscle, and frankly, it doesn't support your spine as well as the others. So on the sides of that rectus abdominis, or that six-pack muscle, if you push through right above the pelvic bone, you can feel a deeper layer of muscles, and you can feel it when you breathe out, which takes us into our next exercise, which is supine diaphragmatic breathing. Breathing deep through the belly. You can kind of see her belly pushing out there. And as she breathes out, that belly presses down, and those core muscles will activate. If you're having trouble finding those muscles, place your hands on either side of your hips and just breathe out a nice short breath. You can also sniff. And feeling that muscle just turn on under your hands is a good way to find that muscle. Now that's how you find it and eventually progress it into more functional activities. Well, let's go back for a second. The other thing that I will say about diaphragmatic breathing is that it changes the nervous system. We've touched a little bit on nerve sensitivity, and I could talk about nerve sensitivity and neuroscience all day. It's fascinating. But doing this deep breathing where you're breathing through the belly stimulates the diaphragmatic nerve. It's a nerve that connects pretty close to your brainstem, comes straight down and attaches to your diaphragm. As you breathe through that belly instead of your chest, breathing through the belly releases a whole bunch of chemicals that our brain produces, and those chemicals deaden our pain experience. Some people have compared those chemicals to being just as strong as some morphine or other painkillers, but they're right in your own body. So those are the stretches, kind of warming up, getting into back strengthening exercises. A bridge, relatively safe for most people, being on your back and lifting your hips off of the table as you support yourself on your shoulders. Now you want to squeeze the butt and maintain a good strong core. Do not hold your breath. Keep breathing out and then lowering back down. Doing 3 sets of 10 of that is a great way to start. To progress that, there's a million ways. Challenge yourself. Lift one leg. Hold for 30 seconds to a minute. Lumbar rotation. Lying down, this is a great one if you're experiencing acute back pain and things are tightened up. Just rolling those hips side to side and letting those relax. You don't want to force yourself into pain. Remember, pain is a signal to our body telling us that something is off. Not necessarily broken, but there might be a sensitive nerve there. You don't want to punish that nerve. Just invite it to relax by introducing rotation. The next is pelvic tilt. Now this is a very different one. It's a little hard to explain, much easier to demonstrate in a clinic. But she is rolling her hips back onto the table, tightening through the core and pressing her low back down into the mat. She's feeling this right in her core as she lengthens through those back muscles. It helps to relax the lumbar paraspinals through a series of cooperative contractions in the body. It also helps with pelvic awareness. A lot of us are not aware of where our hips are sitting when we're sitting or standing or running or doing anything. And that disconnect between our brain, knowing where our hips stand in space, can actually cause a lot of back pain. We have a wonderful pelvic floor therapist who works with us, and she is a guru and has been kind of fundamental in building our program. But she has kind of helped me realize like this is the kind of center of the universe of where our spine sits. If your base is off, well, the top's going to be all over the place. Now, that's kind of the basics of keeping a healthy spine. Now, I save some time for questions here at the ends. But again, remember that if you have back pain, majority of back pain is not serious. It won't stay with you forever, and your imaging does not define you. There's always something that you can do to improve your quality of life and decrease your own back pain. Okay.
Thank you so much, Mike. Do we have any questions? You can put them in the chat box or feel free to unmute yourself. Doesn't look like we have any questions. You must have covered it all. Thank you so much.
Okay, fantastic. All
Yes,
right.
this was fabulous. Thank you for sharing all the tips, especially for your desk, because some of us may have some unorthodox situations right now working from home.
Yes, I'm sure. I'm sure. I've seen some pretty crazy setups.
Oh, I bet. Oh, one person has put, what about a back stimulator?
Oh, that's an excellent question. So back stimulator, I'm assuming that they mean a TENS unit or something with electrical pads that will go on a painful area of the back, and they'll turn that up. It'll create kind of like a buzzing response. It's a great way to modulate pain. So you can kind of think as your nervous system as a two-lane highway. There's northbound and southbound traffic taking information to and from the brain. Now, when you put a TENS unit on, it kind of blocks up that highway. Instead of sending pain signals to the brain, it blocks it up with a nice, relaxing kind of electric stimulation. It's a wonderful way to help modulate back pain. It doesn't necessarily cure the cause of the back pain, though. So we do use TENS a lot in different physical therapy settings. But I would recommend that's a great place to start, but strengthening probably throughout the core and throughout your back will be the overall cure.
Thank you. And the next question we have is, can hip flexors cause back pain?
Absolutely, absolutely they can. So hip flexors, they actually attach, if I'm holding up an imaginary pelvis here, but hip flexors attach to the front of the hip. If they become very tight, they can actually reposition the hip by tilting it forward. As the hips tilt forward, the lumbar spine will actually curve backwards, and you have a greater increase curve back there, which increases pressure on discs and decreases the space for the nerves to exit the spine. Those hip flexors, while they're holding that there the entire time, can really cause some back pain. So lengthening through hip flexors or strengthening that core to reposition the pelvis can be a crucial part of decreasing back pain. That's a great question.
And to kind of add to that, it seems that there's a lot of different areas of the body that could cause back pain. Like, for example, I broke my ankle several years ago, so the flexibility in that ankle isn't the same as the other one. So, of course, that
Mhm.
causes the knees to be different, the hips to be different, and then ultimately the back pain. So, it could be the root of the problem could be really anywhere in your body, shoulders, ankles, that's causing the back pain.
Yes, yeah, and it's amazing to me that you're so much more than just a walking ankle or a walking back or a walking shoulder. Everything is so connected in the body, and that's kind of the specialty of a physical therapist to kind of break that down. Like your pain might be here, but it's coming from down here. We need to address several different places in the body to really correct that. That's yeah, absolutely.
And then this person wrote that they came in late, but what about a yoga wheel back roller, if that's helpful
Oh,
for back
yeah.
pain?
Yeah, so a yoga wheel back roller, I've seen like a few different brands, and some people use like foam rollers as well. Those are kind of, aimed. I think the commercials always show like cracking and like people like, oh, I have no back pain after a few pops, and that's always like, oh, that's what I need, $20 and I'm out of back pain. Now, there are ways that like your back can experience pain through hypomobility. Instead of the back being able to move and twist on itself, things become locked down. And by creating that popping noise through a foam roller or on one of those like a chirp wheel or something like that, you can decrease pain. Now, the next thing that you have to do is not only mobilize your spine, but you also have to teach your body how to use that new mobility. So if you're you know, on a foam roller just on your back and you feel a nice pop, you're like, oh, that feels good. The next thing is to move through that movement and to exercise through that full range of motion, or else what will happen is it'll tighten back down and you'll need a pop in the next few days.
Excellent. Oh gosh, they're coming in now. People are starting to brainstorm.
Yeah, now it's
It says,
starting.
how do you feel about using PEMF for back pain? I'm not sure what that one is. Could you also tell us what it is?
Yeah, I'm not familiar with that one. If they could spell it out for me, that'd be great. It might be a different acronym. Google it on my
I know I was Googling it as well.
phone.
It
Oh,
says pulse electromagnetic field therapy.
you know what? That is fairly new. So they kind of use this for helping bones after they fuse the spine. So most commonly the pulsed electromagnetic fields that it's like bone stimulators is usually what they call it. It has shown to be promising in research and working with like our surgeons here, there's a lot of people, especially after cervical fusions, who will wear that bone stimulator for a period of time for 20 to 30 minutes a day, and it seems to be very helpful. And the research supports it. As far as diminishing back pain with solely the use of that, um, I recommend that more active treatments are used because while that may be beneficial for improving healing rates, life doesn't happen sitting here undergoing a passive treatment. Life happens out here. Life happens when you're running and with your grandkids and wherever you might be. So really getting strength through active movement, through active ranges, and decreasing nerve sensitivity, I think that shows the best promise.
I love that philosophy. It looks like that was it, and we've run out of time. So thank you so much for being with us today.
No, thank you. I enjoyed it. If you guys need any information, just give us a call at St. Mark's. We'd be happy to help you out with any questions.
Thank you. Enjoy this beautiful day.
You too. Bye. Yeah.